I'm Dr. Idokoko, a public health physician and epidemiologist, a member of the Ebola Emergency Operations Center, responding to the current outbreak. Yeah, Ebola virus disease it refers to a disease caused by the Ebola virus that was first seen in 1976 somewhere in the Central African region around Uganda, Congo. Body fluids that include blood, urine, all of the things that could come from the persons that can harbor viruses on surfaces. You have symptoms like fever, the person may have headache, they may have like sore throat, they may have general body weakness, and then intense inability to do anything that is so fast and progressive. You owe yourself the responsibility to observe the basic hygiene like hand washing and keeping don't contaminate surfaces with fluids coming from you. Because you know why it does that? To protect yourself. Because if you do that and every other person does that, we have prevented ourselves from transmitting it to another person. So if everyone observed the basic hygiene practices, we have protected each other. The toilet was not decontaminated after a person who had Ebola virus used it. Then they may have left the virus in those secretions, and the person may contact the virus from those by having contact with those surfaces. It's not sustainable to be able to say you restrict persons, you keep screening persons coming to your facilities for symptoms of Ebola virus also, which you may not be able to know, because the commonest source of those symptoms is not Ebola. It's likely most other infections that are not Ebola. So if people are ill or they have those symptoms that are Ebola-like, they should be directed to seek health care at the nearest facility. Or public facilities should make provisions for basic hygiene to be feasible within those facilities, particularly provision of running water and antiseptic or sanitizers at those venues, particularly their common utilities. Or there are so many other causes of fever. It will be discriminatory and stigmatizing, which is not necessary. And if you send the person away, it goes spreading the infection. So even if you have someone you suspect of having the virus, you should call the helplines so that the people can come and decontaminate those facilities. Because if the person eventually tests positive, the facility needs to be contaminated, and every other person who has had contact, who has been at that facility at that time, needs to be tracked. So it's not just enough to send the person away. So if you suspect the person has Ebola or symptoms of Ebola, restrict, call the helpline, and let technical experts come assess and possibly quarantine, test, and confirm whether this person have Ebola or not. And then before you can, that's about the best you can do for yourself and then for the public. Sure, but Ebola is not a death sentence as it is. Yes, though a large number of the persons who have the disease do die, but it does not mean everyone who had the disease died.